This is video podcast 42 from LearningRadiology.com. Video flashcards, most commons in urinary tract imaging. Hello, I'm William Herring from Albert Einstein Medical Center in Philadelphia. This podcast can be used as audio only, video only, or both. The way this program works is that on side one of the card, which is black, there will be a question, like in what city is the Baltimore Harbor Tunnel? And then on side two, which is gray, there'll be the answer. Baltimore. Let's get started. What is the most common cause of a unilateral, smoothly marginated, enlarged kidney? Pause your computer or MP3 player. A duplicated collecting system. What is the most common cause of a unilateral, lobulated, enlarged kidney? Multiple simple cysts. What is the most common cause of a unilateral, smoothly marginated, small kidney? Chronic renal artery occlusion or stenosis. What is the most common cause of a unilateral, lobulated, small kidney? Reflux nephropathy, chronic atrophic pyelonephritis. What is the most common cause of bilateral, smoothly marginated, but enlarged kidneys? Diabetic nephropathy. What is the most common cause of bilateral, lobulated, and enlarged kidneys? Autosomal dominant, adult, polycystic kidney disease. What is the most common cause of bilateral, smoothly marginated, small kidneys? Generalized arteriosclerosis, nephrosclerosis. What is the most common cause of bilateral, lobulated, small kidneys? Reflux nephropathy, chronic atrophic pyelonephritis. What is the most common cause of medullary nephrocalcinosis? Medullary sponge kidney. What is the most common cause of cortical nephrocalcinosis? Chronic glomerulonephritis. What is the most common cause of renal papillary necrosis? Diabetes. What are the most common manifestations of trauma to the kidney? Contusion or subcapsular hematoma. What is the most common cause of an amputated calyx? A transitional cell carcinoma. What is the most common type of renal backflow? Pyelosinus backflow. What is the most common cause of a teardrop-shaped bladder? Pelvic lipomatosis. What is the most common cause of calcification of the bladder wall? Schistosomiasis. What is the most common type of bladder rupture? An extraperitoneal rupture. What is the most common malignant tumor of the kidney? Metastatic disease found mostly at autopsy. What is the most common primary to metastasize to the kidney? Lung cancer. What is the most common primary renal malignancy? Renal cell carcinoma. What is the most common benign tumor of the kidney? A hamartoma, an angiomyolipoma? What is the most common benign tumor of the ureter? A fibroepithelial polyp. What is the most common benign bladder tumor? A leiomyoma. What is the most common malignant bladder tumor? A transitional cell carcinoma. What is the most common bladder tumor associated with exstrophy of the bladder? An adenocarcinoma. What is the most common cause of medial deviation of the ureters? Retroperitoneal fibrosis, especially the lower ureters. What is the most common cause of lateral deviation of the ureters? Lymphadenopathy, especially the upper ureters. What is the most common cause of ureteral obstruction? A ureteral calculus. What is the most common cause of ureteral calcification? Tuberculosis. What is the most common site of urethral trauma? The posterior urethra. What is the most common cause of a urethral stricture? Trauma. What is the most common cause of urethral obstruction in males? Bladder outlet obstruction from benign prostatic hypertrophy. What is the most common congenital anomaly of the urinary tract? Ureteropelvic junction obstruction. What is the most common renal fusion abnormality? Horseshoe kidney. What is the most common cause of an abdominal mass in the neonate? Hydronephrosis. What is the most common cause of hydronephrosis in neonates? Ureteropelvic junction obstruction. What is the most common renal tumor in children? A Wilms tumor. What is the most common cause of a bladder tumor in children? A rhabdomyosarcoma, sarcoma botryoides. And lastly, what is the most common cause of urethral obstruction in newborn males? Posterior urethral valve.